Rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disorder that primarily affects the joints. It causes chronic inflammation in the joints, leading to pain, stiffness, and swelling. It can affect any joint in the body, but it most commonly affects the hands, feet, wrists, elbows, knees, and ankles. Rheumatoid arthritis occurs when the immune system attacks the lining of the joints, called the synovium. This results in inflammation and thickening of the synovium, which can eventually lead to erosion of the joint and damage to the surrounding cartilage and bone. Symptoms of rheumatoid arthritis. The symptoms of rheumatoid arthritis can vary from person to person and can range from mild to severe. Some common symptoms of RA include joint pain. Pain in the joints, especially in the morning or after prolonged inactivity, is a common symptom. Joint stiffness. Stiffness in the joints, particularly in the morning or after periods of inactivity, is another common symptom of rheumatoid arthritis. Joint swelling. Swelling and inflammation in the joints, which may make them feel tender and warm to the touch. Decreased range of motion. Decreased range of motion or flexibility in the affected joints. Fatigue. Feeling tired or fatigued, which can be caused by the inflammation and pain associated with rheumatoid arthritis. Weight loss. Unexplained weight loss, which can be caused by a combination of decreased appetite and inflammation. Fever. Low-grade fever, which is common in rheumatoid arthritis due to the inflammatory response. Numbness and tingling. Numbness and tingling in the hands and feet, which may be caused by nerve compression due to inflammation and swelling. These symptoms may not all present at the same time or with the same severity, and some people may experience different or additional symptoms. If you experience any of these symptoms, it is important to speak with your doctor for a proper diagnosis and treatment. WHO gets rheumatoid arthritis? Rheumatoid arthritis can affect anyone, but it is most commonly diagnosed in women and in people between the ages of 30 and 60. However, it can also occur in children and in older adults. Some factors that may increase the risk of developing rheumatoid arthritis include genetics. A family history of rheumatoid arthritis or other autoimmune disorders can increase the risk of developing rheumatoid arthritis. Gender. Women are more likely to develop RA than men. Age. Rheumatoid arthritis can develop at any age, but it is most commonly diagnosed in middle-aged adults. Environmental factors. Exposure to certain environmental factors, such as smoking, may increase the risk of developing rheumatoid arthritis. Obesity. Being overweight or obese may increase the risk of developing rheumatoid arthritis. Having one or more of these risk factors does not necessarily mean that a person will develop rheumatoid arthritis, and conversely, some people with rheumatoid arthritis may not have any known risk factors. If you are concerned about your risk of developing rheumatoid arthritis, it is important to speak with your doctor. How does it affect your body? Rheumatoid arthritis primarily affects the joints, but it can also have systemic effects on the body. Here are some ways rheumatoid arthritis can affect your body. Joints. It causes chronic inflammation in the joints, which can lead to pain, stiffness, and swelling. Over time, the inflammation can damage the joint, leading to bone erosion and joint deformities. Skin. Some people with rheumatoid arthritis may develop skin conditions such as rheumatoid nodules, which are small, firm lumps that can appear under the skin. Eyes. Rheumatoid arthritis can cause inflammation in the eyes, which can lead to dryness, redness, and sensitivity to light. In some cases, it can also cause more serious eye conditions, such as scleritis and uveitis. Lungs. It can cause inflammation in the lungs, which can lead to shortness of breath, coughing, and chest pain. Heart. People with rheumatoid arthritis have an increased risk of developing heart disease, possibly due to chronic inflammation. Ra can also cause inflammation in the lining of the heart, a condition known as pericarditis. Blood vessels. Rheumatoid arthritis can cause inflammation in the blood vessels, which can lead to a condition called vasculitis. Vasculitis can cause a range of symptoms, including fever, weight loss, and organ damage. Other organs. Rheumatoid arthritis can also affect other organs, such as the kidneys and nervous system, leading to a range of symptoms depending on the organ affected. Not all people with rheumatoid arthritis will experience these systemic effects, and the severity of symptoms can vary from person to person. Rheumatoid arthritis treatment. The goal of rheumatoid arthritis treatment is to reduce inflammation, relieve pain, and prevent joint damage. Treatment plans can vary depending on the severity of symptoms and the progression of the disease. Here are some common treatments for Ra. Medications. Nonsteroidal anti-inflammatory drugs, NSAIDs, disease-modifying antirheumatic drugs, DMARDs, and biologic agents are often prescribed to treat Ra. NSAIDs help relieve pain and inflammation, while DMARDs and biologics work to slow down or stop the progression of the disease. Physical therapy. Physical therapy can help improve joint function and flexibility, and can also help relieve pain. Lifestyle changes. Exercise, weight management, and stress management techniques can all help manage Ra symptoms. Joint injections. Corticosteroid injections can be given directly into the affected joint to reduce inflammation and pain. Surgery. In some cases, joint replacement surgery may be necessary to relieve pain and restore joint function. It is important to work with a healthcare provider to develop a treatment plan that is tailored to your specific needs and symptoms. Although there isn't a cure for rheumatoid arthritis, early diagnosis and treatment will help prevent disability and increase your chances of remission.